When they told me that I will be in Maine, the first thing I asked was like, where's Maine? Because I never really hear about Maine as in the Philippines. And I looked it up and it was all the way up here, almost pretty much Canada area.
Coming up on Pathways, Maine is home to nurses from all walks of life who have taken different paths to get to where they are. This includes nurses from other countries who are developing more than their nursing skills.
Thanks for joining us on Pathways. I'm your host, Emily Tadlock. You know, nurses train and work everywhere, and where they land along their career path can sometimes mean ending up in a completely different country. So joining me today is Northern Light Health Community Coordinator Victoria Haskel and Isabel Echano, an international nurse at Northern Light AR Gould Hospital. Hi, ladies.
Hi.
Hello. Thanks for joining me today. So, Isabel, let's start with you. Tell me your story. How did you end up in Presque Isle, Maine?
So I have an agency, and they placed me here. Really, it wasn't my choice. When they told me that I will be in Maine, the first thing I asked was like, where's Maine? Because I never really hear about Maine as in the Philippines, and I looked it up, and it was all the way up here, almost pretty much Canada area. Yeah.
So you're originally from the Philippines. And what made you decide to become an international nurse anyway?
Well, I went to nursing school because my mom told me to. I think that's what everyone says, I think. But as I went through school, I started liking it, and I realized that, oh, this is actually for me. My mom was right. Glad I listened.
Yeah, right.
And then, well, the culture in the Philippines is once you're a nurse there, you're not just to work and stay in the Philippines, because there's not really much. We don't get paid well in the Philippines, so our mindset is to leave the country as a nurse. People go to Saudi, in UAE, UK, US mostly. And that's what I had growing up. So as I went through nursing school, okay, I'm going to finish my nursing school, take my exam, have a work experience for 2-3 years, and then I'll leave. I'll start processing my visa and stuff. But then COVID hit.
Oh, right.
Which they stopped sending nurses. They stopped letting nurses to leave the country because of the shortage. And then eventually they opened it up again, and nurses can leave. And that's it was just perfect, because that's when my visa, I was ready to leave, really. I was just fed up with how the situation is in the Philippine nursing scene. And then, the moment they said okay, you're gonna be assigned in Presque Isle, I'm like, yes, sure, wherever, take me out of here.
Yeah, get me out of here.
And then I moved here March of 2022.
Okay.
March 2022, and it's been great so far. So I think the winter was almost over when I arrived. There was still snow, but I was like, okay, I can work with this. And then spring came, summer, fall, it's great. And then winter again.
Which is very different.
Yes.
Yeah. So we'll get back to that in just a minute. So you mentioned that you're part of an international agency. So before we go any further, I kind of wanted to give Victoria a chance to explain a little bit about how international nursing works here at Northern Light Health.
Yeah. So we work with 3 separate agencies, and we just work to try to teach them about the different parts of Maine, and then they tell the nurses about the different parts of Maine, like AR Gould and all the way down to Portland. So, yeah.
So we have them placed at several of our different member hospitals?
Yep.
Okay. So what drove us to start, asking international nurses to join our ranks?
Because I think this started about 5 years ago with starting the international nurse program. But I think it brings a lot to the state having the international nurses here, because a lot of them do convert and end up living here after after their contract is up. So.
Okay. Yeah. And so do you know exactly how many international nurses we have placed throughout Northern Light Health?
We have 57 total.
Wow, 57 international nurses. Can you give us an idea of what countries are represented?
Yeah, so mostly we have the population from the Philippines, but we also serve people from Jamaica, Nigeria, Kenya, India, Iraq, Lebanon, lots of different places around the world.
Wow, that is really cool.
Yeah.
So, Isabel, I'm going to come back to you now. What was it like you moving here? You moved here on your own
Yes, I did.
and you left your family?
Well, yes, just my mom, my brother, and my dad.
Okay. What was that like?
Um, It was okay. I mean, I do get homesick, but moving here, I was very excited. My parents, my mom, especially my mom, was very excited. She would even ask me like almost every week, like, when are you leaving? Like, okay, I'm leaving soon. It was fairly easy, but when I do get homesick, like I just cry, call them, but it's okay.
Okay. So Isabel came here on her own, but we have a lot of international nurses that come and bring their families even. What is that transition like? It can't be easy to figure out housing, where you're going to stay. And then when you move here, the food's different. The grocery store is different. What you buy is different. How do you navigate that? And Isabel, I'll let you answer. And then Victoria, I'd like for you to answer and talk about how we help people navigate that.
Oh, right. Well, the food, it's American food. We have it in the Philippines. But what I just do is I'm so glad that I'm able to cook. So I just buy stuff from Walmart or Graves and just cook Filipino food at home. And if I want like American food, I can go out or just have my partner cook it.
What about housing? How was that?
Housing. Well, I think my agency was talking to someone. It's like they reserved like a place for me, but then by the time I got to talk to the landlord, they gave it to someone like the day before. They gave the lease to someone else, so I had to look for something else somewhere else. So I'm glad I found somewhere nearby the hospital. It was nerve-wracking because I only had like when I moved here, I only had like a budget for like hotel, and I should be able to, but like within a week I should be able to find like a place.
Right.
Yeah, it was nerve-wracking, but luckily I was able to find some place. But from what I know now, it's harder for people to find a place here now.
I think we're seeing that everywhere across the state, but
Yeah.
we do have resources, and I think our staff do the best they can to help support and find stuff too. Victoria, I'll let you talk about that.
Yeah, so the agencies do try to find places for people, but if an international nurse was looking to live here, or if they just needed a new place to live while they were working their contract, then I would be able to help them find a place for their family, and I help find resources for their family too, like schools for the kids and after school programs and just things that maybe they wouldn't necessarily prepare for coming here, like, oh, that's right, I have to register my kid for school, and maybe finding a house near a school. There's just a lot of stuff that when they come here, they realize they might need.
And I think that's really important that we offer that information. And we not only offer information about American culture and how to get into school and how to purchase a home and, different things like that, where to go to buy clothes, because had you ever heard of TJ Maxx? Is that something that you guys have in the Philippines?
No, we don't. We don't have those. We have like big malls with like different shops in it, but Walmart, TJ Maxx, Walgreens. Those are like
Not things you had ever
yes,
heard of.
Martins.
Martins, yeah.
I love
so,
Martins. Yeah.
So you would have never known where to go to find some of those things without someone helping you along the way, which I think is really cool. And so we do some of that, but we also help connect people with cultural resources. Isabel, you were able to find some of that here through your coworkers. But Victoria, we have, if you travel into Bangor or Portland even, there are lots of different cultures living in those communities. And so I think it's kind of neat that there's so many different cultural resources in those areas.
Yeah, it's really nice. And I've worked to get all of those in one place so that when people ask, I can quickly defer them to those places.
Awesome. The Philippines is very different than America. What was the biggest culture shock for you?
Well, initially, it would have to be people saying hi. Like when you pass by them on the streets, like, hi, how are you? I'm like, do I know this person? Like, I was weirded out, really. And then I realized that people are just really nice and they say hi, even if they don't know you. Pedestrians have the right of way. Here, pedestrians just walk through, and I'm shocked, like, oh my gosh, they didn't even look left or right. They don't care. Like,
They know people are going to slow down for them.
Yes, yes. And seniors still work, even at McDonald's, which is great. Because back home, like, we don't see when you start like getting at like 60, 65, you don't really work anymore. You let your kids work and then support you. That's the culture. But here, people they don't pass that. What do you call that?
Burden?
Yes, that burden to your kids. You have your own life, and then you have your their
Kid life, your family life.
Mhm.
Yeah.
And people talk about the weather a lot. Well, because in the Philippines, there's only like sunny and rain or shine. That's all the weather that we have. But here, it's always changing. So I was like, oh, no wonder they always ask about the weather, because it's always changing.
Wow. Yeah. So where you come from in the Philippines, is it busy? Is it like city life? Is it more rural?
I grew up living in it's like in the middle of mountains and city.
Okay.
And then when I graduated, when I started working, I moved to the city. So I really loved the city. So when I moved here, I was like, oh, great. This is a nice, slow-paced life, peaceful, simple. I like it.
Yeah. Okay. Well, that's good to know. So what is it? I was going to say, what do you like most about living in the Presque Isle, Maine area?
Well, besides from the people, life is just simple here, and which is something that I really liked. I think I'm past that age where, partying and stuff. And I'm surprised to see that there's a big Filipino community here. Because
Okay.
when I looked at Maine and Google Maps, I'm like, I don't think Filipinos would want to work here because of just how far up north it is and how cold it is there. But when I arrived here, I met a lot of people, a lot of Filipino people here, and they're just great. They're so supportive, and that's one of the a few things that I like about Maine.
That's great. And so you mentioned that community. Again, I'm going to mention Victoria's title here as community coordinator. That's one of the things that you do, right? Is work to help usher in these international nurses and help them feel at home and part of a community and help connect them to resources. Tell us a little bit about that.
Yeah, so I really try to work hard to give them like a sense of community, and I have a newsletter that I put out every month, and I try to tell them about Maine and I like the things going on in Maine, and I definitely want to start working with the parts of Maine that are more rural, like up here, the places that people coming into Maine may not know much about. So I want to work to educate people on the different parts of Maine and what Maine has to offer.
And it has to offer a lot more than just snow, I promise, Isabel. So, what are some of the things that you've discovered you enjoy now? Have you tried like snowshoeing or sledding or anything like that?
I tried skiing, and I don't know. I think I just had the bad first experience and I never really did it again. Just because. So went to Mars Hill, Big Rock. It was me and my partner. And I did great on the bunny hill.
Okay, yeah.
And we hopped on the lift.
Okay.
And 10 minutes later, I'm like, this is taking a while. So apparently we hopped on the wrong lift. We went all the way at the top of the mountain.
Oh.
And he was just like, oh, just do pizza. I'm like, I can't do pizza. So I just took off my skis and just went on my butt and just slid down.
Oh, so,
and
you made it down.
I did.
You made
And
it down the mountain.
everyone was like, a lot of the people who were skiing there was like stopping by and asking like, hey, are you okay? Are you injured? Do you need help? I'm like, no, I'm okay. I haven't broken any bones yet. But yes, I like that. This I'll give it a try some other time.
Okay.
But I do like hiking.
Okay, great. There's lots of that in this area.
Kayaking. Oh my gosh.
Oh,
that's
yeah.
nice. Just basking in the sun. And the lakes are great too. Maybe the beaches, maybe it's too cold for me. But the lakes, they get warm during summer, so that I can dip myself into.
I love it. Awesome. So, so then now we've kind of talked about some of the recreational things, differences. Tell me a little bit about the differences between nursing in the Philippines and nursing here in Maine.
Ooh. That's, I think it's definitely, and nursing here would be definitely much easier work compared to the Philippines.
Okay.
Here I have maximum of 6 patients because I work nights, so I have maximum of 6 patients. We have CNAs. Our charge nurses are very helpful, but in the Philippines, I used to handle like we were doing primary nursing at first, but then when COVID hit, we did functional nursing, which I was handling about like 20 patients.
Wow.
It's either I could be like a medication nurse or a charge nurse, but still it's a lot of like things to keep in mind, like handling 20 lives
Wow.
per shift.
That's a lot.
And we do like 8 hours of per shift. So we have to go there. We have to be at work like 5 days in a week. But here, you only have to go 3 days because you have to do like 12-hour shifts, which is great. You have more. I feel like work and life balance is better here.
Okay.
Plus, if I do overtime, I can feel like I could see it in my paycheck. I get to like spend have fun with my money. But back home, like even if you work tirelessly 16 hours a day, 5 days or 6 days a week even, you don't really like feel it because we get paid like, do you want to know how much I get paid in the Philippines?
Sure.
$250 a month as a nurse. That's why we just suck up those 2 years of experience just to leave.
Okay. Well, that's interesting to know. I mean, and I think it's also interesting that you've been able to move to Presque Isle, Maine, and find several people that are also Filipino and create your own community up here.
Mm-hmm.
How was it for you meeting people from Presque Isle, Maine? Were they welcoming? What's the community welcoming?
Oh yes, everyone here is very welcoming. I'm so glad that I was placed here. When I started here in Gould, I was training with a Filipino nurse who's a staff here.
Okay.
She's not a travel nurse. She's a staff here, and she walked me through everything, which is great. Like, I felt it made it easier for me to transition, because she can tell me, oh, like, here we do this. I know back in the Philippines you do this, but here you can't do this, but you can do this and that.
Okay. So it was good to have that support and that role model to really look to.
Yes.
I want to go off of something you just mentioned, that the nurse who trained you is also Filipino. She was an international nurse, but now she is staff and she lives here full time. She decided to stay in Presque Isle, Maine. So, Victoria, how many international nurses do we have decide to stay in Maine?
So over the past 4 years, we've had 83 people decide to stay.
Wow.
Yep.
83 people, it seems like a small number in a large population, but in terms of working in a hospital system, 83 people from different countries coming here and wanting to stay in Maine, that's a big deal. We're doing something right, I think.
Yep. And in the time that I've been here, I think about every nurse except for one has decided to be a permanent staff member and live here full time. So.
Wow.
Yeah.
So, Isabel, would you consider living in Maine?
Oh, definitely.
Yeah?
Maybe I'll move to Southern Maine.
Southern Maine, where it's a little
Northern
bit
Maine
warmer?
is too cold. Southern Maine, I do like, yes.
Okay. Well, that's good to know. Well, and it's also nice to know that our Maine communities are welcoming. I don't know if you can tell from the way that I talk that I'm not originally from Maine. I am from the U.S., but from North Carolina, which is a southern state in the United States, and moved to Maine and also found the culture very welcoming and decided to stay here as well. I've now lived in Maine for about 7 years, and it's home. It's home.
It is. It's nice. It's calming being here.
Awesome. What would you say to encourage another international nurse who may be listening to this podcast, who knows, to come work in Maine and work with Northern Light Health?
Well, get your experience, that's for sure, before going to another country and working here, because it will prepare you for it. I think my experience in the Philippines really prepared me, shaped me to be like a good enough nurse here.
Good. And Victoria, what would you say for international nurses looking to even finish out their contracts and stay in Maine?
I would say that Maine's a great place to live, and we're continuing to build our community for international people. So it's a great place to live.
I agree. It is. I'm glad I'm here.
Awesome. Thanks, ladies.
Thank you for listening to this episode of Pathways. Please join us next time for a new episode. There are several ways you can tune in. On our website at northernlighthealth.org/healthyhappywise. We are also on Apple, YouTube, and Spotify, which makes it easy for you to listen on the go on your favorite app.